Hello, my name is Lacey Sommer, and this is my head-to-toe assessment for my health assessment course. I wasn't able to get anyone that was willing to come over and let me do a head-to-toe assessment on them with this whole COVID thing, so I'm just going to just present on the steps of the head-to-toe assessment and what I would do when I do a head-to-toe assessment. So first I would wash my hands. So I can get this. Wash my hands. And then I would introduce myself to my patient, let them know who I am, my job title, and what I'm going to be doing. So I'm going to be doing a head-to-toe assessment. Gather all my equipment. So I'm going to need a pen light, a blood pressure cuff, thermometer, tongue depressor, stethoscope, like a sterile sharp object of some kind, a sterile soft object like a cotton ball, and then something for the patient to smell like an alcohol swab. And then I would check 2 patient identifiers. So I would ask the patient their name and date of birth, and ask them to spell their last name. And then after I've confirmed that I have the right patient, washed my hands, all that stuff, then I would check to see they're alert and oriented. So ask them what the date is, who the current president is, do you know where you are? Questions like that, just to see like if they're alert and oriented to person, place, that sort of thing. Then I would assess their temperature. So I would take a thermometer and I would put it underneath their tongue and have them close their mouth, ensuring that they haven't drank anything cold in the last 20 minutes, anything hot in the last 20 minutes. And then I would check their temperature. Anything around 98.6 is normal. Then I would measure their blood pressure. So I would put the blood pressure cuff on, making sure that it's pointing to the radial artery, or the artery right here, and then put my stethoscope there, and then I would tighten the blood pressure cuff all the way up to about 180, and then slowly release the cuff and listen for that first heartbeat sound, and then that's our systolic blood pressure. And then I'd wait until I heard the last sound I heard, the last heart sound, and that's the diastolic blood pressure, so like 120/80, right around there is normal. Then I would assess their heart rate. So basically I would take my 2 fingers on the radial artery right here, and then I would count every heartbeat for 60 seconds, and then that would be the heart rate. So for example, like 85. Anything between 60 and 100 is normal. Then I would assess the respiratory rate. So generally I would just kind of watch the rise and fall of their chest as I'm like doing the rest of the assessment. I wouldn't just sit there and stare at them. I would, when I'm listening to their breath sounds, that's when I tend to also count the respiratory rate. And it was just the amount of times their chest rises and falls in 60 seconds. Then I would get their height and weight. So I would measure their height with a height measure, and then I would get their weight on a scale. Then after I do all the vital signs, stats, and neurological indicators, then I would start with the head and just kind of work my way down. So the head and the face, I would check for distribution and the condition of their hair. Do they have any patches of hair missing? Is the hair clean? Check their scalp for bumps, any lesions, if they have lice or anything like that. I would just kind of check their hair, check their scalp, and then I would palpate their skull for any tenderness on their skull. Just lightly palpate and ask them if they feel anything if it's tender at all. And then I would check the symmetrical face movement. So I'd have them smile, have them raise their eyebrows, stick out their tongue, and just make sure everything's symmetrical. And then I would assess sharp and dull sensation on the face. So generally with that is a little something a little bit sharp on their cheeks, see if they can feel that, and then the cotton ball on their cheeks, so something soft and then something a little bit sharp to see if they can feel that. After the face, then I would look, after the head and face, I would look at their eyes and assess for symmetry of the eyes, their eyebrow and eyelash distribution. So do they have eyelashes? Do they have eyebrows? Do they have hair missing? Eyelashes missing? I would check their conjunctiva of their eyes. Is it white like it's supposed to? Is it yellow? Is it a gray color? Check the sclera, for colors. Assess their cornea. And then I would do perla, so that's pupils are equal, round, and reactive to light. So that's where I would use my pen light and just have them, look, straight ahead, and then I would just kind of shine the light into their eyes coming from the side. Make sure their pupils dilate as they're supposed to on both sides. And then I would check the 6 cardinal positions of the gaze. So, have the light on and then follow my fingers. So you go up this way, you go down, and then you go up and then go down, and then side to side. And just making sure that without moving their head, of course, just move your eyes, just to make sure that both eyes move as they're supposed to. And then I would assess their vision with the Snellen chart. So I would have them stand, certain, like 20, 10 feet or whatever from the Snellen chart, cover one eye, read the lines all the way down until, and then write their vision like 2020, 2030, 2015, whatever that result was. Then I would go and I would check their ears. So I would inspect and palpate the auricle for lesions and tenderness. So kind of like on the inside, just look inside gently, see if there's anything going on in there. Look inside the ear and assess for discharge, and look at the tympanic membrane. So I would take a light and just kind of shine the light in there so I can see inside the ear canal. And then I would use a tuning fork and do Weber's test and Rhine test. And then I would assess the patient's hearing with the whisper test, just to see if they can hear whispered words. Then next I would look at their nose, palpate nose and assess symmetry. Check the septum, so that's here. Check inside the nostrils. Verify that they can breathe through each nostril just fine. Verify that their sense of smell is intact, so I'd have them smell like an alcohol wipe. And then I'd palpate their sinuses, so like in this area, just to make sure there's no swelling, anything, and tenderness. So I just palpate right in here. Next, I would check their mouth and throat. So I would look at their lips, the moistness and color of the lips. Are their lips pink? Are they dry and cracked, or are they moist? Then I would inspect their teeth and their gums. Are their teeth there, or do they have any teeth missing? Is their gums pink? Are they moist? Are they dry? Do they have sores? Just how their teeth and gums look. I would assess their buccal mucosa and palate, so the inside of their cheeks. I would examine their tongue, so I'd have them stick their tongue out and see how that looks. Look at their uvula, so they'd stick their tongue out, and I'd take the tongue depressor, shine a light, and just take a look at their uvula and their tonsils back in the back. And then I would palpate the jaw right around here for any tenderness, swelling, anything along those lines. And then I would also palpate around the, like right here. This is where the lymph nodes are, so just palpate for swelling or tenderness there as well. And then next I would go to the neck and shoulders. So check neck range of motion, so I'd have them turn their head left to right, up and down. Check their shoulder shrug, so I'd put my hands on their shoulder, have them shrug, and then I'd push down. The lymph nodes, so lymph nodes here, check around this area, check back underneath here, and then under the armpits. Palpate their neck, palpate their trachea, and just check for any bumps, any tenderness, and then check for jugular vein distension. So along the neck here, if their jugular vein is distended, like sticking out quite a bit, that could be a sign of a heart problem. So I would check for that too. Then we'd move to the lungs and the thorax. So I'd listen to the lung sounds front and back, and that's where I would also count their respiratory rate. So, just start along in between the intercostal and just go all the way down and around, and then same down and around, listening to the lungs, and then same with the back, down and around. And then I'd palpate their thorax, so just kind of going down, just checking for any bumps, tenderness. And then I would assess their spinal curvature, so I'd have them bend over, and then I would look to see if their spine goes in a normal curve or if it's got an S curve, and just look at that. And then I would ask them if they have any coughing or respiratory issues. They have a cough, is it dry, is it productive, do they have difficulty breathing, shortness of breath, anything like that. Then I would go to their circulatory system and palpate the carotid and temporal arteries bilaterally. So I would palpate here. You never want to push on both sides at the same time, but just lightly palpate on both sides, and right here as well on both sides. And then I would listen to the heartbeat and the heart valves. So ape to man, so arterial, pulmonic, tricuspid, and mitral are the heart valves I would listen to. So here, 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 and here. And then also listen to the heartbeat. It's the normal lub-dub. There's no murmur, there's no extra heartbeat, there's no heartbeats being skipped. Then we'd move down to the GI system. So I'd inspect their abdomen. Is it round? Is it distended? Is it firm? Is it soft? I would listen to all 4 quadrants of the abdomen for bowel sounds. So we would start right here, listen, and then go up, and then we go over, and then we go down, and we're listening. So this is the ascending, transverse, and descending colons. So I would just listen for bowel sounds, active bowel sounds, or absence of any bowel sounds. Check pulses in arms. So again, I would check on the radial on both arms, make sure that they're pretty close to the same. It's a little bit of deviations normal, but you want to make sure that it's not a huge difference. So I would check both radial pulses on both arms. And then I would do the capillary refill test on their fingers. So you go like this, you hold it down, and it's supposed to come back in less than 3 seconds. And then that tells us that they've got good oxygenation. Anything longer than 3 seconds, they might not be oxygenating properly. Check their skin turgor. So go like this, and if it stays tented for a while, then that means they're dehydrated. The skin needs to go, as soon as you tent it, it goes right back to normal. So I would check that, and also you can check here too. And then assess sharp and dull sensations on the arm. So something a little bit sharp on the arm, and then the cotton ball on the arm, on both arms, just so that see what their sharp and dull sensations like. Then I'd move down to the legs and feet. I would assess range of motion and strengthen their legs and ankles. So have them bend their knee, have them raise their leg, have them turn their ankles, and then check the cap refill on their toes, same way that I did here, but just on their toenails. And then I would check the pulses of the legs and the feet. So behind the knee, the popliteal artery behind the knee, I think that's the one. And then on top of the foot, that's the popliteal, on top of the foot one, check the pulse on top of the foot, behind the foot, on the back of the foot, on either side of the Achilles heel. Check the pulse there, and then behind the knee. And then again, assess sharp and dull sensation on their legs. And then I would assess their gait. I'd have them walk for me, and then I would just assess that they are able to walk normally, that they don't have a limp, that they're able to get around just fine, and there's no issues with their gait. They stand up straight, they're not tilted or slouched. And then there is also the checking the pubic hair and checking for tenderness and lumps and lesions in the femoral area, right in this area. And then just kind of palpating where the lymph nodes are in that area as well. And then the breast exam, just kind of palpating the breasts, checking for lumps, bumps, any tenderness, anything along those lines. So that is my head to toe assessment. And thank you for watching.